Okay, let me share my screen for week 13 of the maternal and child health nursing, particularly obstetrics. So we'll talk about the nursing role and nursing care during normal pregnancy and birth. Let's start with the legal and ethical aspects of genetic screening and counseling. And if this topic comes out in the board exam, okay, when will we need to do genetic screening? The answer is if it is for if it is for the benefit of the child. So what are the nursing responsibilities in genetic counseling? Is number one, participation by couples or individuals in genetic screening must be elective. So it should not be an emergency. It should be a planned activity. Okay. And then you have here people desiring genetic screening must sign an informed consent before the procedure. So you have to tell them what is the purpose, okay, of the procedure, how would the procedure be done, and what are the things that they have to do and to adjust to during the moment that they will be having the genetic screening. Results must be interpreted correctly, yet provided to the individuals as quickly as possible. So it means that we should not be delaying, okay, in showing them what is the result of the genetic screening as soon as possible. So to avoid inducing anxiety to our patient. And then we have here the results must not be withheld from the individuals as quickly as possible. So we should not be hiding, okay, the result, whether it will be a positive or negative result. And the people who are waiting for the result must be informed of what is the result of the genetic screening. The results must not be withheld from the individuals and must be given only to those persons directly involved. You should not be discussing this to people who are not a part of the test, who are not or so who should not be informed about the results of the test. Okay. And after genetic counseling, persons must not be coerced to undergo procedures such as abortion or sterilization. So should there be an abnormality um from that the child might inherit from the couples, okay, it is not our task to tell them or we should not compel them or coerce them to undergo abortion or sterilization. It should always be the decision of the couple if they wanted to. The nursing role and nursing care during normal pregnancy and birth. We have here pregnant patients with unique needs or concerns. So we have here an obese patient. So what is our problem with the obese patient? Sometimes we are doing the NST. So in NST, you have your three transducers. You remember your transducer for the FHT, for the contraction. You also have your transducer for um your fetal activity. So in the placement of the transducers, you may need to have the straps, and if the patient is obese and you could not uh, you may not be, you know, you may have to stretch the straps, and or the straps will not be enough for the size of the patient, and that could give or affect, it could affect the results of the NST. Another one is FHT because of the syempre, of the fats of the patient. Okay, because of the fats of the patient. Okay, you have to be very careful in locating for the FHT, but sometimes it is not audible. Okay, and it's difficult for them to catch urine if they are not mobile due to obesity. So again, the midstream urine is the one needed for urinalysis, and urinalysis during pregnancy is very important for us to be able to identify the presence of UTI that might contribute to a preterm labor. So what will we do? It is the tasking of the midwife or the nurse, okay, to help the patient to catch the urine if in case the patient is obese. Next, pregnant patient in a wheelchair. Okay, so what will you do? You have to help the patient avoid pressure injuries or to take breaks and stretch. So this one, okay, sitting in a wheelchair for a long time might affect or might aggravate the situation of the patient the due to the gravid uterus, due to the weight of the gravid uterus. So what will the patient need to do or the nurse needs to do is to again at least elevate, or I mean stretch, okay, or help the patient stand up so that uh, the pressure the pressure that is exerted by the patient towards the wheelchair will be at least alleviated, or what we mean, para hindi lang talaga siya matagal na nakaupo. Okay. Pregnant clients who are hearing challenged, they could not hear their FHT and can't assess their baby. Okay. So this one, if they could not hear their FHT and they can't assess their baby, they might be having anxiety of what is the baby is doing inside them, or how is the condition of the baby at that very moment. So this one, you have to be very careful. But in other places wherein the patient could avail to have hearing aids, then it will be better for them to be able to bond not only the connection that the FHT of the baby brings to the mother, but again, to lessen the anxiety of the mother of how the baby is doing inside them. Another one is we have here common this one is adolescent pregnancy or pregnant adolescent. These are common for females who marry 12 to 13 years old and get pregnant at the age of 15. Why? Because the characteristic of the di ba we have what we call as menarche. So if the female will have menarche at the age of 12 to 13, it is considered as an ovulatory and irregular. Okay? It's an ovulatory and irregular. So it means if it's an ovulatory, it means that the patient will not be getting pregnant at this time. Okay, so this one, that's why the book is saying us that the patient will probably get pregnant at the age of 18. What are the reasons? What are the possible reasons why this adolescent get pregnant? Lack or limited sex education in public schools. But now, um, sex education is now being implemented in public schools. Okay, lack of knowledge about or the failure to use contraception. Like for example, they might know that pills could prevent pregnancy, or but they really don't know that if there is a delay in the intake of the pills, it could lead to pregnancy. So you have to educate them. Lack of access to contraceptives, they might be ashamed of asking um for these contraceptives, okay, because of their age. Parental limitation on adolescents' access to contraceptives, or their parents would not allow them to have contraceptives because they might be thinking that their child is sexually active. But this time, okay, it is better for us to prevent unwanted pregnancy than to limit this adolescents' access to contraceptives. Desire of adolescents to have a baby, so they may want to have playmates. Okay, they may want to have playmates. They may ano na to? They may be curious of how it feels like to have a child, okay? Or maybe a victim of rape or incest. Ayan. Believe that pregnancy will free them from toxic home situations and intolerable school, or that is their only way of getting out of the toxicity of their life. So you have to educate them really. Okay, that it is more toxic to get pregnant at early age, not only for complication, the possibility of complication, but of course, the change in their life as a woman. And in 1960s, this is written in the book, pregnant adolescents were sent abroad to stay at home to keep their pregnancy and return as if nothing happened to them. So this is very obvious. Like for example, sa mga artista, the artist in the TV, what they will do if not only the adolescents, okay, what will they do if they get pregnant or they will have unwanted pregnancies? They will go abroad, deliver their baby, and come back to the Philippines as if nothing happened. Okay, and that is again a reality, and it's written in the book of Flag. Okay. We have the developmental tasks of an adolescent. Adolescent is a vulnerable time for pregnancy, yes, because of the possibility of complication, because of their inability to care for their baby. Okay. The developmental task of an adolescent is to establish a self-worth or value system to emancipate, okay? So this one, if they wanted to emancipate from parents or adjust to a new body image and to choose a vocation, gusto lang nilang maging malaya, okay? They may feel devastated, okay? They may feel devastated um if they will be separated from their parents during childbirth, okay? There might be a separation anxiety this time, or again, they might think that they could not be successful in the upbringing of the child without their parents. And for this time, it is a period of transition for them or adjustment. Okay, some may feel virtually trapped into dependence if they will depend on their parents. So sometimes if they will choose to stay with their parents, okay, or they will be dependent to their parents, they will be trapped in a situation wherein nagkakautang na loob sila. So those are two thoughts that they might be thinking, that, for example, they wanted to stay with their parents, but if because they don't want to be trapped, they need to go away. But if they go away, they also they may feel devastated. Okay. And then we have here, they may face problems on healthcare decisions because they are young. There are a lot of things that they could not understand about these healthcare decisions. They might be they might observe, or they might have observed their relatives or neighbors about, or on this process, or on this developmental task. But then again, when it comes to them, they may still face problems if they don't understand some things. And then we have here, pregnant adolescents are regarded as emancipated minors or mature minor, a person capable of healthcare decisions and may sign a permission for their care. So this is really one of the new things that we have to understand, that even this 15 years old or adolescent, they are now allowed to the Philippine scenario, they are now allowed to sign their consent because they're considered what? Emancipated minors or mature minors. So if you go to the hospital, and the hospital will just tell you that they need the parents of the client because the client is 18 years old and below, then you have to tell them that according to the Book of Flag, okay, they are considered as emancipated minors. Next, nursing responsibilities. Observe privacy and confidentiality. Since this might be a very difficult time for them, we have to keep it private, okay? They because they might have some reasons, okay, that we might not understand, okay, regarding pregnancy. Encourage them to continue school. Now, you have to encourage them, but do not compel them or do not force them, because it's still their decisions. Again, as nurses, we don't give them, or we don't decide for them, or we don't uh tell them to decide on this matter. Okay. Thank you, ma'am. Okay, so we don't need we don't I mean, we don't decide for them. We have to present options, if and then they will be the one to choose from that or those options that we have presented for them. Help them to receive proper prenatal care, because they might not understand the value of having prenatal care, or they might just be referring to their relatives or um neighbors that have given birth normally, even if they didn't have the prenatal care. So we have here factors contributing to the lack of prenatal care: denial of pregnancy. So as what I've told you during the past lecture, that denial is one of the coping mechanism of this adolescent. They deny that they're pregnant. They don't believe that they're pregnant. But if the pregnant is an adult or married, okay, what will they feel is ambivalence. They are half happy, they are half happy, half sad. So happy sila na nabuntis sila, if they're an adult, pero malungkot sila because of the responsibilities that pregnancy might give to them. Next, the lack of knowledge of the importance of prenatal care. So again, they might not understand what is or what are the benefits of seeking prenatal care. Okay, dependence on others for transportation. This one, since they don't still have work, or they could not work for themselves, or um, they might need somebody else to bring them to the prenatal facility, or to the health facility or the healthcare facility, then this could be a factor of the lack of prenatal care to patients. And feeling awkward in the prenatal setting, okay, because the sorry for the redundancy, because the prenatal setting is an adult setting. So if it's an adult setting, the adult might judge them, okay, the fear of a social stigma. So they might be feeling awkward at that moment. So fear of first pelvic examination, yan. Okay, they might be shy at the first time because they're still at that age, or difficulty of relating to authority figures because of the fear of being judged. Okay, but then again, as nurses, we have to remember that whoever our patients and whatever the situation, we still don't have the right to judge our client. What else are your nursing responsibilities? Know the health history and family profile, because some are homeless. Okay, they might need to get married to have a home or to have a family, or sometimes they are mentally challenged. So we have a patient before. Um, 11 years old, 12 years old. Okay, so since she is mentally retarded, okay, her father used her for starting when she was 4 years old until the 11th. Okay, until when she went to the hospital, we have seen the clitoris falling down literally, okay, and fungal infections around her vagina. But the child doesn't know about, the adolescent doesn't know about, okay, the what happened to her because she is mentally retarded or mentally challenged. Financial support, so they might need money. Okay, it's very usual. Actually, in other parts of the world, like for example, Bali, Indonesia, wherein um this younger generation are allowed to have sex because of this, that they need financial support, and just we just did not question them. But then again, we have to educate them of what are the disadvantages of engaging sex or engaging in sex at a very early age. Okay. And you have to know if they have plans of continuing school. So what is the importance of knowing their plans of continuing school? So we could give them um, family planning education, or health education and family planning. So we have to give them options. If, for example, if they wanted to go to school, then we could give them, or we could share to them family planning methods or techniques, okay, for them to be able to continue their school. Do physical examination, explain every procedure, because again, their inability to understand what is happening to them could affect, okay, their understanding of the procedure that you are doing to them. Educate the adolescent regarding pregnancy, of what to expect, what are the signs and symptoms, what could be the danger signs of pregnancy, or what are the things that should be done in the different trimesters and until the birth of the child. You have to emphasize also the importance of good nutrition, because this one they might take it for granted, because again, adolescents are um ano na to? Adolescents are fond of eating, ano na to, yung mga junk foods or fast food chains. So you have to emphasize to them that whatever they take in, it is also the food of their child. So you have to tell them what is healthy and what is not. Number 8, assess the activity and rest, like participation in sports, and suggest other alternatives. Like for example, if they love to participate in sports and they're pregnant, you have to tell them the advantages and disadvantages. Or again, you focus on the disadvantages of attending to these sports during pregnancy. Explain the physiologic changes during pregnancy, because they might think that this might be abnormal. So you have to tell them what is normal and what is abnormal, so they will not be having anxiety, okay, of the changes during pregnancy. Do a health education on childbirth preparation with other adolescents, so they will feel that they are belong, or they belong. Okay, so you have to let them feel that they are not the only person who suffer from that um part of their life. It's a challenging part of life, or so that they will not be afraid of coping with their situation. Guide them with birth preparations, what to do, what are the things to be prepared, what will they expect, who will be there for them at that moment, okay? And let them have options after childbirth on what are their plans for the baby. Again, um we don't suggest for anything, but you have to ask them, do you plan to go to school? Do you still, or you want to go back to your family? So you have to listen to them of the things that they'll be planning to do after giving birth. Okay, next tayo. Complications of pregnancy, since they are out of the reproductive age. They are out of the reproductive age. So we have here the possible complications of iron deficiency, anemia, preterm labor. Again, if the uterus or the reproductive organs are not yet ready to conceive, right? So below 18, you are not really allowed to have sex, because again, your reproductive organ is not yet ready to conceive. So again, you expect of the complications. Cephalopelvic disproportion comes with the height, of course. If the height of the adolescent is less than 4'11", then we expect cephalopelvic disproportion. And this could be the reason that the patient or the client will have to undergo cesarean section. And of course, the possibility of postpartum hemorrhage, because again, of the immaturity of the reproductive system. Inability to adapt postpartally, of course, it will not be very easy, okay, to adapt postpartally. Even though if you are an adult giving birth, then there's still a problem. So again, there are a lot of things that the adolescent will not understand. So you have to help them adapt postpartally. Lack of knowledge about infant care, how to take care of the baby, what are the normal what are the signs and symptoms of a baby who is not well. So you have to really educate them on about infant care. Okay, we also have here the pregnant of patient over 40 years old. Okay, so when we say over 40 years old, again, it's out of the reproductive age because the reproductive age is 18 to 35. So the advanced maternal age are pregnant clients and at the age of 35 and older at delivery. So they say that in the past it is believed that being pregnant at the age of 40 will increase the risk of having complications, but it was not proven. As long as the patient is seeking for prenatal care, okay, it might not mean that if you are over the age of 40, okay, you will be prone to complications. But usually pregnant patients over 40 are hypertensive or previously diagnosed with varicosities or hemorrhoids. So again, because of the time that we are here on earth, okay, the time that they get pregnant, they already have those complications or nauna na silang magkaroon ng hypertension before they got pregnant. By the age of 40, they may have a major role challenge because if they have an established career, then their time will be divided to taking care of their children or their child and their career. Okay, pregnancy may be life changing for them because they would have to adjust to a new task or to adjust to new tasking as to their new tasking as a mother. Okay. So before they would tell you that if the patient is more than 40 years old or above 35, they would say that your child could be either a genius or mentally retarded, but that is not, again, that is not proven. Okay. Okay, what are the developmental tasks? Over 40 years old, okay, should expand their awareness or develop generativity, that is the sense of moving away from themselves and becoming involved in the world. So you have seen that most of their time, okay, most of their time ano to, they spend it, right? They spend it to the community, okay, their belongingness, okay. Then we have here, they may find themselves joining clubs. Okay? They may find themselves joining clubs, coaching little league game teams, organizing fundraising or community events or activities they shunned when they were younger. So this will make it even difficult for them to adjust, okay, in the situations because before the baby came into their lives, then they are now torn to, I mean, parenting and joining these activities or organizations. Being pregnant at the age of 40 may cause ambivalence, of course. They will be happy, but they will be sad because of the responsibilities and this life-changing situation. People who are pregnant at the age of 40 may be those who delayed childbearing because of their career and education, or those who are having their final child. So this one, it might be the reason is they went abroad, and they will have in vitro fertilization, or some will save their eggs in a laboratory, then they will just have to uh, get pregnant when they wanted it to. So those could be the possible reasons. Prenatal assessment, know their health history and how they feel about pregnancy. Yeah, it's very important for you to know their feelings. And of course, their health history, if they have comorbid conditions that might affect their pregnancy. Assess their financial family profile and financial stability, if they are able to um, if they can finance pregnancy. Okay. Assess day history by asking about the time and length of walking and exercise and their diet, because most of them will just be career woman. Okay. Most of them are heads of an institution or institutions, and then they might be sitting down more or spend their time sitting down to papers, but they are not really having exercises, and that could affect their health as a pregnant patient and the health of the baby as well. Do a physical examination to note possible complications if they have or they have not identified, okay, they have not identified the things or the condition that they might have. Chromosomal assessment to rule out the possibility of having a child with Down syndrome, but again, being pregnant at the age of 40 doesn't guarantee everyone to have a genius or a Down syndrome or a child with Down syndrome. So, because it was not proven, if you wanted to know about this, then the safest thing to do is to do chromosomal assessment for you to be able to have a peace of mind, okay, during pregnancy. Educate them about nutrition and the importance of prenatal classes. So, ma'am, bakit? sa prenatal classes because these patients are 40 years old, they might believe that they know everything. So you have to tell them that there are things that the doctor needs them to know, to tell, or that the doctor needs to tell them for pregnancy. Okay, that they might not know at the moment. Why about nutrition? Because these people or women are busy with their lives, so baka mamaya hindi na sila kumakain ng tama. Complications of pregnancy, okay? Gestational hypertension because they are old, they might have comorbid condition, difficulty accepting the event, okay? They might be surprised, okay, of the possibility that they're pregnant. Postpartum hemorrhage because the uterus is too old, or failure to progress in labor because the uterus is too old. Hi, ma'am. Let's continue, guys. So we have here the pregnant patient with a physical or intellectual disability. So these are special conditions that you might encounter during your duties in the clinical area. So this pregnant patients with conditions such as vision, hearing, cognitive, or neurologic or orthopedic disabilities are sheltered by their families so that those with even moderately physically challenging conditions could not meet potential sexual or marriage partners, and so they didn't become pregnant. So there are times as that again these patients um are pregnant for several reasons. So they have the rights, okay, of people with physical or cognitive disabilities. A hospital could not deny the care to them even when their disabling condition require complicated treatment or require extra personnel or time. So the hospital could not just tell them that they will have to look for another hospital because their condition is um uh toxic, or it might need a complicated treatment. Again, the rights of a patient, a normal patient, to the rights of a patient with this disabilities is the same. Okay, a patient with disability has the same rights with other persons, as what I've mentioned, and their babies should not be taken at birth or forced to terminate a pregnancy or undergo sterilization unless they choose this option. So again, we should not be deciding for the patient. So we have to modify some things during pregnancy, emergency contact persons. So you have to get, okay, who are the emergency contact persons, okay, so that we will have someone to talk to or to contact to when there should there be emergencies. Suppliers of transportation who will bring them to the hospital if the patient will deliver. Individual considerations such as mobility, elimination, and possible autonomic responses. So again, you have to take note of their ability to move, to eliminate, okay? And of course, the possible autonomic responses, we'll have to talk about this one later. Review every medicine that they are taking to check safety for pregnancy. And if mostly at home, again, this one, why do you have to review every medicine? Because they might not understand, okay, what are the benefits of this medication, and or when will be the right time to check for this, or right time to take for this medication. So you have to really make it sure that they are taking it on the right time. If mostly at home, make sure that their prenatal vitamins are complete. Again, these patients have special conditions, so you have to make it sure that all their prenatal vitamins will be given to them, and explain the importance of sun exposure during pregnancy, okay, for the supply of dopamine, of course. Next is, okay, who with regards to emergency contacts, evaluate their ability to contact someone. Could they use the cell phone? Do they understand how to use the cell phone? Could they be using the cell phone or not? Or do they have the ability to use the cell phone? Evaluate the presence of cell phones and telephones if they have. Do they know how to call emergency hotlines? Check the availability of specially designed phones for patients with cerebral palsy and spinal cord injuries. Okay. And then check for the presence of hearing aids for deaf patients. So these are very important for these patients who have special conditions. For transportation, assess their ability to come for prenatal care. So would they be able to drive, or they will be sent by somebody else, okay, or they will just be depending for transportation from other people. Arrange appointment schedule so they will not be coming to the hospital or to the institution if there are so many patients, to give them, of course, um ano na to, if to give them a time to relax during that time. Okay, so because we are avoiding autonomic responses for these clients, don't if they don't qualify for driver's license, okay, they might be needing someone to drive for them. They may need a hand controlled car as pregnancy progresses, so this could be very special to those persons again that who have the ability to have this one. But sa mga wala talagang kaya, then they will be depending for transportation from the other person. For mobility, patients in wheelchair will be taught how to press their hand against the armrest, lift their buttocks up for every 5 seconds every hour to prevent pressure injuries again, because this might just complicate pregnancy. And then assess patients with balance. Okay, again, they may need crutches. We are avoiding fall again because of possible complications that it might bring to pregnancy. Assess the need for physical therapy so that the mother will be having a treatment, the treatment during pregnancy to ease, okay, pregnancy. Autonomic responses, what are this is what we call as autonomic dysreflexia. Okay, for patients with spinal cord injuries, kasi pwede silang magkaroon ng cardiovascular disease. So we have to prevent this one. Their BP, according to flag, could range from 300 over 150. And that is, again, a deadly sign and symptom of a patient with autonomic dysreflexia. So you have to put an indwelling Foley catheter to prevent bladder pressure, because pressure, pain, or untoward stressors to the patient could really lead them to autonomic dysreflexia. Again, who are these patients who could have autonomic dysreflexia is those who have spinal cord injuries. And you have to anticipate the need for an antihypertensive, okay, to prevent the occurrence of CVD. Prenatal care modifications to meet specific needs. So we have to again, you do your IE with a consent. You have to tell them, if you need somebody else to explain to them the procedure, so that they can understand the procedure, then you have to do so. Secure ramp for patients in a wheelchair to make them comfortable. And then dorsal recumbent position is better for patients with spinal cord injury and cerebral palsy. So these are the positions, okay, that might help them to feel comfortable during delivery. More staff members are needed to assist them with dressing and undressing to make it sure that they're comfortable. Patients may not know that they become pregnant. They may need someone to talk about it. So again, this one is very difficult for the nurse to address, kasi minsan the patient might not know who is the father of their child, and they do not know when it happened. So you have to really listen. Okay, you have to really listen from them. You have to let them express their feelings, and that is the only thing that you could do at this moment. For blind patients, because they could not see, lahat ng naririnig nila, you have to tell them if you're closing the door, if you're getting the instrument, if you are moving something, so they will not be having anxiety of what is happening inside the delivery room. And you have to ensure the patient that you are, or that you are maintaining privacy. The only thing that we could do for them is to give them the maximum level of care that we could. Okay? Pregnancy education for those who have cognitive disability. Okay, you should be giving those instructions to their relative or anybody else with them. Okay, because they may not understand your instructions, or they may because of that they may fail to follow these instructions. Okay, deaf, make sure that you have an assistive hearing device for these patients for them to be able to understand you. And you have to emphasize to them the need for nutrition and exercise still, even if they have a very limiting condition. Encourage the partner to participate in childbirth preparation class, so that the partner will be the one navigating or preparing or helping this patient with a disability. Next, modifications of labor and birth. Instruct patients with spinal cord injury to palpate their uterus on the third trimester for them to be able to feel the contractions. Patient with spinal cord injury and muscle spasticity will have to undergo CSO. They will not have autonomic dysreflexia, because again, pain and pressure could lead them to have this autonomic dysreflexia that could lead to CVD. act as advocates for patients who are deaf and blind. Okay, when you say advocate, you should be there for the patient. Okay, help the patient decide on certain situations that are involved in the delivery process. And then for blind patients, identify all the sounds in the delivery room because they could be it could be frightening to them or for them. So you have to really uh, give them the best attention, okay, during that time. Okay, so that is our lesson for week 13.